A disturbing and deadly trend is on the rise in Georgia. More than 500 people died last year from overdosing on prescription drugs, and that number is even higher than the year before. Fox 31's Franklin White connects us to what doctors say is the cause.
It may not seem like much, but last year, deaths from prescription drug overdoses rose 3%.
Never exceed the recommended amount by your physician or the amount that's printed on the back or the side of the container.
Strong words of advice from pharmacist Kimberly Floyd, who knows what could happen if people don't pay close attention and follow exact directions.
These are the type of situations that can lead to problems and can result in overdoses.
This week, the Georgia Bureau of Investigation released new information that says of the 686 overdose deaths, 520 were from prescription drugs.
Because they're easier to buy, everybody has them around the house.
Lisa Amadeo, a physician at Phoebe Putney Memorial Hospital, says a lot of that has to do with people not knowing they're close to overdosing.
Especially if you have multiple medical problems, you see different physicians, everybody gives you different prescriptions, but you don't know, you're not a pharmacist or a doctor, you don't know.
The report says some of the most common drugs found in toxicology reports are oxycodone, methadone, and hydrocodone, all narcotic pain relievers.
Instead of going to street drugs, it's much easier to go and get these medications. So we see a lot of abuse of them, a lot of addiction of them, and unfortunately a lot of overdose.
The study also found that 200 of the deaths were people between the ages of 45 and 54. And in terms of race, Caucasians accounted for 91% and 54% were male. Health officials say if you're unsure of your medication dosage, you should contact your pharmacist. Franklin White, Fox 31.